To start our next session, which is around the power of FBOs and advocates, I'd like to introduce the two speakers who will be with me on this panel. And I'll just invite them up if they don't mind taking a seat. Reverend Kariuki and Karen Sichinga. So Reverend Moses Kariuki is a clergy in the Presbyterian Church of East Africa, working in Maua Parish in Kenya. Currently, he's the chaplain to a number of church hospitals, health centers, and dispensaries that are faith-based and sponsored by PCEA. We also have Mrs. Karen Sichinga with us, who is the executive director of the Church's Health Association of Zambia, CHAZ, a network of church hospitals and clinics delivering health services worldwide, particularly in rural and hard-to-reach areas. But before we get started with the panel, first of all, raise your hand if you're an advocate. Okay, every hand should be up right now. You all are advocates, and we're going to convince you with this panel. If you don't think that you are right now, you will in 45 minutes. But before we get to the discussion, I do want to share a verse that I often go back to when I feel a little discouraged in advocacy. Sometimes that can happen when things don't get done as quickly as you might think they would, or you don't feel like people are listening. And it's Proverbs 31, verses 8 and 9. Speak up for those who cannot speak for themselves, for the rights of all who are destitute. Speak up and judge fairly. Defend the rights of the poor and needy. So that's just one of many verses that call us to advocacy in the Bible. And we're going to talk a little bit more about some practical examples here with Reverend Moses and Mrs. Sichinga. Excuse me. I'm going to make this a little less formal, and I'm going to sit with them. But I can't take this one. Okay. Because it's afternoon now and you guys need to stay awake, and so we're going to keep this a bit conversational. I have some questions that I'm going to ask, but we do have time for you all to ask questions too, so listen to the answers, but start thinking of questions that you might want to ask our panelists as well. So to both of you, just to start, advocacy can often sound like something that's very intimidating, especially if you've never done it before. It can sound a bit scary. Can both of you give an example of a time where you felt intimidated going into a meeting with a government official? And what did you do to prepare for that meeting? How did you approach it? How did you deal with that situation? And we'll start with you, Reverend Moses.
Well, thank you very much. First of all, it is true that when I went to the government officials, that is the county government, it was that way because first I was not prepared, but later, after being prepared by the CCIH and CHAC, which was funded by Gate Foundation, I had courage. And you see, to some extent, the county government officials, after the development of the health activities, those guys thought that you were trying to investigate them. So they could intimidate you when you asked some questions. But later they came to understand that it was out of goodwill and the betterment of humanity. Yeah.
Yeah, that's a great example, because I think sometimes we can think of advocacy being adversarial. And that's a good example, I think, that you've outlined, where sometimes the government officials do feel like, well, you're here to attack me or criticize me, but so oftentimes we want advocacy to be helpful. Mrs. Sichinga, could you also answer that question?
My experience was tough. Minister of Health had just deployed graduates from the University of Zambia and some of our institutions to mission health facilities and employing them as administrators of church hospitals. And so there was an outcry. There were calls from mission hospitals. This can't happen. Recognizing the fact that these mission hospitals had their own administrators who were from the church. And so there was an outcry, and I and my management team had to mobilize church leaders, both from the Catholic Church and Protestant churches. So we engaged the Minister for Health, and we're not getting anywhere. So we advised the church then to get to the Republican president. And we were lucky, and an audience was given. But in order for us to be ready for that meeting to meet the President of the Republic of Zambia, we had to make sure that we prepare our church leaders. We also prepare the board to face the Republican president. And so we prepared talking notes. For me, the intimidating part, because that was the first time I was meeting that particular president, and I had to make sure that I had the information at the tip of my fingers about the issue. And so when we went into State House, the president, of course, there was the Minister of Health who said what he needed to say, which wasn't very pleasant to the church leaders. And so the president came to our aid and simply said, no, excuse me, church leaders, excuse me, church board and management. I know that some of my ministers are extremely arrogant. I can't believe that this is what happens in church hospitals. So I was also expected to actually give an input to the president about what was on the ground. It was initially intimidated, but because we went very prepared as management, it was much easier.
Always good to remember preparation. Mrs. Sichinga, you mentioned mobilizing church leaders, and there really have been times in our past history in advocacy where the voice of faith leaders has been the tipping point on a policy or justice issue. And one that really comes to mind was when faith communities became more and more involved in the response to HIV and AIDS, and especially here in the U.S., faith communities helping bring about the creation of the PEPFAR program. Could you talk about another time where you really saw the voices of faith leaders making the difference in getting action on a particular issue, where the faith leaders really helped tip the balance on a particular issue just because of how they raised their voices?
I think so about the issue on family planning. We have to understand that the church leaders have had different views, but increasingly, we began to get criticism from the Minister of Health that your church leaders do not want to participate in family planning. Your church leaders are antagonizing messages on family planning. So we had to engage them. But first of all, we had, as the Secretariat, that is the technical wing of the church in health, we had to introspect. And we had to make sure that, we gave an impression to the church leaders that we were on their side. After all, we were established by them and we're not working against them. But what we needed is to facilitate that process. So we engaged the church leaders. But what we found in that dialogue, church has about 17 denomination church leaders. So we work with all the 17 church leaders. So in that dialogue, we soon realized that it wasn't that they were against family planning, but that they wanted more information, like in the era of HIV and AIDS in the 80s, they wanted more information to be comfortable to talk about family planning. And a number of them said, look, we can contribute, we can advocate for family planning, but we don't know as much.
Yeah. And then that's where Mona came in, right?
Yes,
absolutely. Reverend Kariuki, could you answer that same question? Just a time where you saw pastors or faith leaders really kind of make a difference on an advocacy issue? Could you answer that same question about when you saw faith leaders really make a difference on a policy or an advocacy issue?
Well, to the church leaders, we had a time that we brought them together, and they were prepared so that they could meet the crises that were there. And we had time together, and after they were given the knowledge on family planning, the facts, they were able to advocate that through our pulpit, because we have people day in, day out, and therefore we were able to meet with them during the public services, even our counseling, and when we visit our people, that is in pastoral visits. Therefore, we used that opportunity so that we could help them to bring healthy families.
Yeah, family planning, I think, is an interesting issue for the faith community to be involved in because so much stigma exists. So that's really interesting that both of you shared that a similar example. Reverend Kariuki, especially in the Kenyan context, I've been able to travel to Kenya, I think 6 or 7 times now, and with health being devolved to the counties, you kind of have a different situation where you might not just be advocating to the Ministry of Health at the national level, but now you have county governors, county governments, health committees that you will be advocating with as well. Now that some of those decisions are being made closer to the people in Kenya, have you seen a difference in how communities are advocating, or a difference in how decisions are being made in Kenya? Have there been improvements in how health is being carried out at the county level?
Well, after the launch of the new constitution, that is in 2010, the health ministry was devolved to the county government. We have 47 of them, and the services are there. And because this is a young government and it is introducing new things there, it is good to note that the ministry, there are those people who are taking the responsibility of the ministry, but some of them are not medics. Therefore, there are those challenges. However, after being trained, we were able to sit with the county government. Those are in the ministry, and the governors gave us the opportunity. And we shared together. And later, despite the challenges that were there, the faith-based facilities improved because the county government noted that we were not competing with them. We wanted just to partner and move together with them so that we achieve something common as we serve God and humanity. And this one have really helped because already now they are accommodating us because they noted that 40% of the services are from the faith-based organizations, and now they even incorporate us in their meetings as they make their policies, and therefore we work together in harmony.
That's wonderful to hear. I mean, ideally, the advocacy leads to partnerships. Again, getting back to, I think, what you were saying earlier about not having those relationships be adversarial. How do we try to help one another, governments and faith-based organizations working together? Mrs. Sichinga, getting faith leaders to engage in advocacy can be really difficult. They have other jobs, faith leaders. They're pastoring to their communities and have their own families and potentially obligations at home. But it's even harder probably when the topic is controversial. And you talked a bit about family planning. How have you worked to really motivate faith leaders to talk about those kinds of issues that are more sensitive or maybe misunderstood? Is there something that you say or that you do to get them to want to learn about a more controversial issue?
Thank you. What has worked for Charles is that, first of all, sorry. So what has worked for Charles? Can you hear me? Yeah. Okay. What has worked for Charles is, first of all, as a secretariat and the technical wing of the church in health, is that we have had to understand and appreciate the church position on a given issue. We also have had to understand that the denominations are not homogeneous, but have some doctrinal differences, and therefore our need to respect and support the different views and doctrine on family planning, for example. We also have had to appreciate the time it might take for the church leaders to reflect on an issue from a theological viewpoint. In this regard, we needed to be patient and allow ample time for the reflection on the issue at hand, while we served as a resource to provide factual information for their decision making. In view of this, we had to understand the reasons for some of our church's leaders' reluctance to family planning. We found out that the fundamental of God's calling to procreate, fill the earth, and also to be good steward of the earth. For example, the procreation, we had to provide the information that is about timing, spacing, and not necessarily stopping women and or families from having more children. Therefore, we have had to to make leaders understand that we were not challenging this fundamental core. It was very important for us to make sure that they understand that we are representing them to the Ministry of Health and Government, that we are on their side. And so while we continued to provide factual information, we needed them to understand that we were not challenging the fundamental calling than their belief. So what we have learned from that interaction is that church leaders are by the nature of their work are involved in advocacy. All they need is facilitation. Look, they're involved in winning souls for Christ. And that's a lot of advocacy. And that's a lot of work. It is a lot of work. It converts somebody to follow Christ and to start believing in this Christ as their savior. It is a lot of advocacy. So it's not something new. That's what we have learned. But in terms of other issues on health and health advocacy, we've learned that they can do it better if we just facilitate and acknowledge that they are masters in advocacy, but they need for more information so that they're comfortable to discuss on family planning. We've also learned that they have a task of winning souls, like I said, for Christ, and the social teaching of the church entails that the church speaks for those who cannot speak for themselves. We've been given a verse from Proverbs here, and that I'm not going to deliver on that one. But more important also, we have also learned that church leaders are great advocacy assets in health service delivery, and that their involvement can lead to improvement of desired health outcomes, such as immunization, family planning, maternal and child health, 90 by 90 by 90.
I love that faith leaders might not think that they do advocacy, but bringing people to Christ, there's a persistence. You have to have a good message. You have to be prepared. Many similarities to advocacy. That's a wonderful example. Reverend Kariuki, you as a pastor, you did not perhaps go to seminary to become a health advocate. So what changed your mind to get you involved in speaking up for health issues? Why is this something that you are passionate about?
Well, it's a technical question, but first of all, it is good to know that Jesus Christ himself was the first physician, and he calls all of you in that ministry. However, it is good to note that when people are not healthy and families, also the church is sick. Therefore, I had the opportunity, after being invited by the CCIH and CHAK, that is Christian Health Organization of Kenya, which I stated that was funded by the Gate Foundation. We had a training for 5 days, and of course they did a follow-up, and they trained me on the area of family planning and medic communication skills, which acted like an eye-opener, and I was able to have the family planning facts, and was even able to refer clients and my members and the community to the right place. And finally, I was also able to communicate confidentiality in confidence to the government officials on matters of health. Also, in my congregation, we had many challenges when it comes to mother and child health, and finally we buried many of them, and that one triggered my mind, and even we brought other pastors on board so that they could be trained not to have a sick and dying church, because Christ's mission is that he came so that we may have life and have it in its fullness. Therefore, the Gate Foundation did a great job through CCIH and CHAK, and that is it. Yeah.
That's wonderful. I mean, spiritual health and physical health being the roles of the pastors, I think it's a wonderful thing to see a focus on both from so many faith leaders around the world. We have some time for questions from all of you. And I see my dear friend Dave Robinson with his hand up.
Thanks very much for all you've shared. Dave Robinson was involved with World Vision's Ebola response in Sierra Leone. And one of the challenges there was engaging the full interreligious council and all of the denominations and all of the faiths in Sierra Leone together. From your experience, how does the interfaith or interreligious dynamic impact advocacy for the benefit of an entire nation where you have mixed faith, mixed religious groups, Christian, Muslim, others? If you could share from your experience on, does that add an additional challenge? And how does that unify the faith leaders of a country when you do advocacy together?
There is a challenge, and we experienced that, I think, last year, because we had a conference in Kenya where we had the Roman Catholic people. You know, when it comes to the issues of family planning, we have an issue there. And also there was a challenge from the floor, from a Muslim. And of course, you know, to them, having children is part of their evangelism. And what we did is only to change the language so that they could understand. We are saying the same thing, but the communication matters. For example, in Kenya, we don't talk mainly of family planning, but we talk of spacing, balancing the family, so that we'll have healthy children, healthy mother, they will have education. Therefore, we are not talking of having 2, 3 children, but we are talking of having children that you are able to bring up, and finally, they will be a people, they will be a nation. Therefore, we were able to share with the Muslims, because, you know, to them, as they continue to bear, you know, that is the part of their evangelism. Therefore, the statement was, let us have a healthy family. And in that, we agreed. The Roman Catholic, we used the line that they will understand, and of course, you know, it is from the Papa himself. Therefore, we go into that area, and they do understand that language, that we use the natural method, and they accommodate that, and they agree. Therefore, it was a challenge, but we have really worked together with them. And in Kenya now, it's not a major problem. Yeah.
I think for Chaz, in Zambia, in terms of family planning, we're working with the Muslims as well. And we find that they have a common understanding that all, whether Muslim, Baha'i, or Christian, Protestant, or Catholic, all of them agree that abortion is a no-go area. So they have some commonalities, and we take advantage of those commonalities to mobilize them so that they're speaking the same voice. But speaking of the genesis of Chaz, it was way back in 1933. In 1933, we had 2 medical committees. There was one Protestant medical committee and one Catholic medical committees. And these 2 committees used to sit in each other's committees, and they soon realized that we're actually talking about the same thing. And so discussions began now to combine the 2 committees into what is now known as CHAZ for greater advocacy impact. And CHAZ is strong today because the Catholics and the Protestants are under one umbrella called CHAZ.
I'll just start where you actually ended, talking about abortion, because we know that is not one of the family planning methods. And probably you started there because I know the Catholics believe that one of the methods is actually causing abortion, because the child actually starts when it is actually trying to develop before it is destroyed, and therefore you should not use that particular method. But I was standing up to say, when you were talking, we were talking about churches in general. Could we actually tap from what other churches are doing, which is positive, and talk more about it, so that the others can learn. Because I know the Protestants really embrace family planning with all the methods. And some of the Catholics come to them for services. Because even though their policy does not accept that they should offer family planning in their services, it does not mean individuals cannot use family planning methods. And therefore, we have noticed in our country that they go to the other facilities and receive family planning methods. And therefore, we can tap into this and make it available to everybody while encouraging them to use the other methods that they actually agree with, because they have the natural methods, all of these that they use, and so on. And maybe that can still be very helpful. I don't know what your experience is, because sometimes we can always go around to have things done and done perfectly.
Well, for the Churches Health Association of Zambia, we have the Catholics, and they are the majority in the membership. So there they would not, while the facilities, the Catholic facilities, would not have other methods, but promote the natural family planning method, we make sure that we have a referral system. So, and even all the workers who are assigned to family planning clinic or family planning program, they are taught in other methods, and so they make references. So you can refer these people to community where we have family planning commodity distributors, or a government facility that may be near. So that when the women come to a Catholic facility, they are given all the information, and so that they have a choice as to which method they opt to use. So it's the referral system, ensuring that you have a strong referral system, and that the women who come to the clinic for family planning are aware where to go for what method.
Are you ready? Okay, I wrote this one down. To what extent has healthcare advocacy become reinventing the wheel when we as Christians are restrained by the world from pointing out the axle on the healthcare bus is broken by the consequences of sin? And where I'm going with that is, while we were talking about this, I went and grabbed some statistics on alcohol, 176 billion in the US, drugs, 114 billion, smoking, 137 billion, STDs, 16 billion. These are all behavioral type things that as Christians we would say, yeah, there's a pretty good linkage to sin here. And I stopped at 443 billion for the year. And so, anyway, I think you get the gist of it.
I mean, I would say, at least for me doing advocacy in the US, where I see the power of faith leaders then is we're all sinners. We're all making mistakes every day. Some of them might be health-related mistakes. Where faith leaders can have really powerful conversations is by speaking the truth with love based on what they know about how their congregations can best care for themselves and the bodies that have been given to them for a short term in this world by the Lord. So how do they best care for themselves? And ideally you do that in a way, and I'd love to hear Reverend Kariuki, because he actually does this, comment as well. I mean, how do you counsel and guide people in a way that they will receive that message? Because it can be very hard to say to someone, don't drink, don't smoke, don't eat bad food. So you have to find the right kind of messages that they're going to understand. Your body is a treasured vessel, and you're here on this earth to carry out the Lord's will for your life. And you need to be making health choices that help you, enable you to do that. Reverend Kariuki, would you want to comment on that as well?
Well, when we preach and talk to people, our key word is that it is the fullness of life. And whatever God has given us, remember He gave us the free will. Therefore, you are there. We teach you people, we give you the right thing. Then after that, you are told now to choose. And we tell you the outcome. Therefore, as you continue to do that, we partner together with the medics people so that you know what is in you and the outcome. Therefore, we don't force one, but we bring the truth in love as she has stated. Therefore, I think the major thing is that we give the facts, then after that, you choose the way to pass. But remember the outcome.
Sorry?
I'm just making a contribution.
You already asked a question.
I'm just making a contribution to the answer. I think the churches are involved in non-communicable disease control now, and they talk to the people in the various communities about care of the body, which is a temple of the Holy Spirit. And I think during this session, we'll be talking about non-communicable diseases, which are a result of some of these things that we consume. We take pride in consuming them, and they destroy the body. So I think we are not quiet about.
Thank you. We'll take maybe two more questions.
Well,
I think this is actually more of a contribution too, in answer to the idea about that sin is bringing disease to the world. I don't want to argue. I mean, that is true, but I think that we need to remember that, through the fall, I mean, that happened a long time ago. That's not a new thing, that disease entered the world because of man's sinfulness. And I don't think we should focus on the sinfulness of people. I think we ought to focus on the redeeming power of Christ. So I think that's the way to interact with people. And I think as people get to know Jesus, just as me getting to know Jesus, my life changes incrementally, and it's changed over time. There are things I'm still doing that are wrong and not respectful of my body or not respectful of Christ, but I know He's going to continue to redeem me. So I think we can offer that redemptive message and know that, these things are not new. They happened, at the beginning of time in the garden. So,
Anybody have? I see one way back here. Oh, well, there's one right by you, but then the gentleman back here will be next.
Okay, thank you. Mine is going to be a comment pretty much in line with what I finished off in my presentation this morning, where I talked about the health institutions and the churches now moving in completely different directions. And also in line with sustainability, I think one of our challenges is that we are so vertical. So we go to the churches to engage with them when we have a topic. So, voluntary medical male circumcision, let's talk to the church leader so that they can be on our side. Now it's family planning, let's go there now so that they could have a buy-in. I think we should have a systematic way and a holistic approach to say that we are same family. The church health institution at different levels, a local level or at the national level, the Christian Health Association should not be a stranger with the churches. And if we engage and discuss mental health, dementia, cerebral palsy, vaccinations, we don't have to discuss and come to a conclusion. But what we need is to create an environment where there's continuous capacity building, knowledge exchange, so that we understand and learn the concerns, their fears, their worries from their side. We are also empowering them. All of a sudden, when they have to counsel somebody, they know a little more about hepatitis, about jaundice. And I think we will be opening doors where when a hot issue or a topic we really want to address comes, we already have this rapport with the church community. And then we'll be able to have an impact. And several of them, we have other structures, for example, seminaries. We can go for a talk to a seminary, I think as a Christian Health Association, if you want to go to have a 2-hour session at the seminary, I don't think they can say no, because we are family. So we just want to have a talk and discuss. That's an opening, a starting point. So what I would say is take initiative.
Sure, thank you. I do want to make sure we only have a few more minutes, so please, if you have a question, because we have these wonderful panelists, if you want to have some dialogue, I know there's a lot of time for that, hopefully yet today and tomorrow, but questions, please. Okay, if there's someone with a question, that'd be fantastic. I just want to make sure we take advantage of our panelists.
Thank you very much. We're talking about advocacy, and I would like to refer to one of our speakers this morning, Dr. Mwai, when he was talking about the challenge we're facing as health providers, in the fact that we are preaching health, we're administering medicines to cure people, but the same church is also advocating for, I'm not sure what I should say spiritual, but other ways of healing and driving the disease, where we're talking about people not taking their medication, and that we've got powers to heal. And we have NCDs, we've got HIV, we've got all sorts of things, cancers. How do we advocate within the church to speak with one voice so that we heal the people?
Well, thank you very much. That is a challenge, but first of all, it is good to note that even Jesus Christ himself, when his disciples came back to report after the mission, he told them, if those people are using my name, they belong to us. That is an indication that there are people who will come in the name of pastors, in quote, but they are not. Therefore, they will fight the medication, they will fight what you are saying in the ministry of health, but they are not real pastors. Therefore, it is good we notice them. Like now, back in our country, we have even fake doctors. They are there. And even they have their methods. And of course, we cannot just dismiss you because of those people using your name. Therefore, we have that challenge. But to us, we have those people that are qualified, and we know that we are co-workers with you. When you are working on the other side, we are doing it far away in the other side. Therefore, we work together, and I'm sure that with the time, we continue realizing, and we teach our people, we enlighten them, so that they will know the right people to follow as they give the voice of the church. Not every person calling himself or herself a pastor is a pastor.
Yeah, we had those issues in Zambia. I'm glad you brought it up. So we had some pastors telling people who were on ARVs to stop because they can heal them. So what we did then, we working with the Ministry of Health, we produced a pamphlet to just educate them. But we also went beyond that. I think we sponsored a radio program so that we had one of the very prominent bishop speaking to all the so-called pastors and church leaders that, you stop saying these things. So hearing from one of them, I think in Zambia did help. And so we began to hear less of that kind of messages. So we had to use one very prominent bishop to discourage those others who were giving controversial messages on ARVs.
One more question.
Hi, Mona from CCIH. You all have given a lot of family planning examples, which is wonderful, but this isn't just about family planning, this is about advocacy. And so, Karen, this question is for you. Chaz has been a leader in the Christian Health Associations, especially, of having wonderful success advocating with the Ministry of Health, having MOUs, having a good relationship. And I'm wondering if you can just give a few examples of how you've come to have that success. I think you are a model for a lot of other faith-based organizations and Christian health associations.
Thank you. That's very humbling, but I want to acknowledge there are ACHAP members here who are equally strong. But thank you very much. It's humbling. I think for Charles management, the last 9 years, I'll just use the example, the steps I took to develop that very strong relationship with the Minister of Health. So when I was appointed, I went and sought audience with the permanent secretary. This is the untold story. And I went to him and I simply said, "Sir, we are not in competition. We're here. Tell us where to go. Tell us where there's a gap and you want us to help." So he said to me, "This is very good news. I haven't heard this in Charles for many years. What I have felt all along was that we were in competition." And the other thing I did in that position was that I realized that when Charles was established, it was established with 4 major roles. Advocacy was number 1. And for 30, 40 years, we had underplayed. We didn't even have an advocacy office. So we, as management, we went to the board and presented and gave them a write-up that we needed a full-fledged advocacy office. Now, with the Ministry of Health, also, we as management, we decided we are going to give them their place. We're going to make sure that they feel that they are government and we are just, we are church that has been there before them, before they were born as Zambia, and that we have some comparative advantage in working with the communities. And if there are any community programs, we are there as a resource, entity that they can tap on. And we kept nurturing that relationship and improving on the MOU. And with a full-fledged advocacy office, then we made sure that we had contacts in the Ministry of Health, that the advocacy office would go to planning and development, have that brotherly or sisterly relationship, and just a phone call would make the difference. So the way the Charles structure is organized is that the chairperson of the board relates with the minister. The executive director relates with the permanent secretary, and that's the way it is. The heads of department relates with the directors at the Ministry of Health, and that's how we communicate. But when we have an issue that needs to go to the president, then we have to call on the church leadership, then we go to the president. But it's a relationship with government. You have to continuously work on it, nurture it, and make them feel that they are government. As soon as they begin to feel that you are in competition, then trouble begins. I think for me, and for us as Charles management, that is exactly what has worked. And also not going to the media, talking about government. When Ministry of Health has provided you with a forum where you engage them, or closed door with them, the PS and his team, the ED and her team or his team, you engage in a dialogue, closed door, and say, this isn't working. So if they have given you that forum, there's no need to be going to the media and talking about the Ministry of Health. For us, I think that has been crucial, and that's what has worked. Now, we are in a situation where now, when donors go to the Ministry of Health, the Ministry of Health is able to say, okay, this strategy I think we would like to do, but go to Charles first. We want Charles to test. And when it works with Charles, we'll scale it up. Donor A, we want you to go and work with Charles. Start with Charles first. So that's the way it works. But I think it's giving them their place and also respecting that they are a government. You can't fight government.
And even the Bible tells us respect, listen to governments. Well, I just want to thank our 2 panelists so much. Would you join me in saying thank you to them? And who's an advocate? Who's an advocate? Everybody. Thank you all so much.